I'm Ben C.
I'm Dr. V, the medical legal guys. Today we're going to be giving an update on the Depo-Provera litigation.
A meningioma is a type of brain tumor, and it is the type of brain tumor that is caused by Depo-Provera. Why do people have different results from different meningioma tumors? How does that all work when you've got somebody that doesn't have a surgery, and then you've got people who have massive craniotomy surgery?
The decision to operate depends on size, location, symptoms, and signs.
You could have a meningioma that's taken years to develop and is 5 or 6 or 7 times bigger than another meningioma that's in a different part of the brain, like you say. And you could have a smaller meningioma that will actually cause more problems than the larger meningioma. Is that fair?
True. And, these are serious problems. And it's not like a knee replacement. There are places in the brain where it's more difficult surgeries. There's no real routine brain surgery because bad things happen. Tumors will have more vascularity. They may have more bleeding during surgery. Not every brain tumor can be completely resected by all neurosurgeons. There might be just a few neurosurgeons who have the skill to provide complete removals. So this is a very bad problem.
Not all neurosurgeons do brain surgery. So you've got a more limited number of people who even operate on the brain, right?
So neurosurgeons who do brain tumor work, they're often in academic centers with serious meningiomas, have to travel.
We want the best for our clients. And so, of course, the best thing is to get the best care. And the ultimate best thing would be for this to have never developed. But that's something that is beyond their control because of the lack of information and in many respects beyond the physician's control, because through these years, there was a lack of information being provided to the doctors.
The meningeal cell line that's in the meninges, without Depo-Provera, those cells are still being replaced, okay? Because a cell doesn't live forever, okay? And Depo-Provera will cause the cell division to be more often. The more often you have cell division, you could have a mutation. Mutations happen all the time. Most mutations, they just kind of fade away. And that mutation is when cells divide, the DNA splits and then replicates, okay? You have a DNA that has changed.
And that's the problem.
Most mutations just go away, but then there are certain mutations that don't go away and they become a meningioma.
And that's not a good thing. That's a bad thing. Right?
It's a bad thing if that mutation is one that causes cancer, okay, or benign tumors. So you have different mutations. Those different mutations cause different types of meningiomas. And now they understand which meningiomas should have radiation therapy after resection because they're more aggressive. So they could understand based on the DNA how these meningiomas behave. So symptoms of meningiomas. So a common location is in the frontal area, which is the front of the brain. Frontal tumors can affect smell. They could affect vision, pressure in the brain, imbalance, incoordination, cognitive problems, and that could lead to, the diagnosis of a meningioma. And then complications from brain surgery. Those are the patients that I took care of in rehab hospitals. And the main complication after meningioma resection is bleeding, okay? And if you bleed in the brain, that could cause neurological loss, kind of like a stroke, and swallowing problems, walking problems, significant level of dependence. So these are serious injuries. You don't want a meningioma. You don't want to have to go to brain surgery. We have terrified women going for operations. Who can be relaxed going into a brain surgery? It's terrifying.
Well, and we know that, and I know you know it because we've talked to the same clients who have been going into brain surgery. One recent client we've had many conversations with, and it's really a tough deal because you really don't know exactly what's going to happen. And the doctor will need to inform them. I need to inform you, Miss Smith, that you are about to undergo this procedure. It's a serious procedure. Usually it's a lengthy multi-hour procedure. And then all of these things can happen during this surgery. So it also can sometimes really instill fear and anxiety and worry in the patient that is undergoing it. And unfortunately, it's the truth. And unfortunately, those things can occur. Not every surgery results in 100% recovery.
Then you have radiation therapy, and radiation therapy is 7% risk of dementia long term. I've taken care of people with post-radiation dementia in younger people. It is a bad deal.
Does every patient who undergoes meningioma have radiation therapy?
The goal with any resection of meningioma is always to try getting all of it out. But there are some tumors that you can't get out because they're in a location where there's a fear that you may cause more harm than good. If you have a grade 1 that you can't get all of it out, you're going to have radiation therapy. If you have a grade 2 tumor and it's completely resected, that you may get a recommendation for radiation therapy. Grade 3 acts malignant. Generally, those patients get resection plus radiation. So that's kind of the way it works. But I'm not a neurosurgeon, and those are questions that you'll be asking your neurosurgeon. As a rehab doctor, I would take care of the patients who had complications. Those who had a operation that went bad with significant neurological deficits, or who have chronic meningiomas and other problems. That's kind of the field that I used to practice. So if you've suffered a meningioma with Depo-Provera, Ben Martin, myself, we will look at your case individually. We understand the seriousness of these injuries. We are litigating these cases. We have developed our own experts, and we've prosecuted pharmaceutical litigations
for years. Every case is not a fileable case, and sometimes they become unfileable because of the passage of time. It's rather important that we all remember that timing is important, and so it's important to remember these cases should be evaluated sooner rather than later. It's been a pleasure today, Dr. V, and forward to further discussions on Depo-Provera and the other things that we talk about.